Redensity-1. So what are the advantages of using cannula? The advantage of using cannula is it's quick, it is less traumatic, and many patients have experienced the use of cannula before. The disadvantage of the use of cannula for Redensity-1 is that you are not targeting the correct depth. So you are relying on diffusion of the product upward because cannula generally moves within the subcutaneous plane. So what do? I draw a line vertically down from the lateral canthus, and then I draw a line between the nasal sulcus and the bottom part of the helix of the earlobe, and that is my entry point. I'm using a 27 gauge 40 millimeter cannula with a 25 gauge entry needle. So remember we spoke about the fact that if you use cannula, you are unlikely going to be able to get the cannula into the dermis. So what do you do, or what do I do, in order to maximize the availability of my Redensity-1 for the dermis? So what I do is, I make sure my cannula is beveled up, and then you see a little bit of tugging of the skin, in order for me to get as close to the dermis as possible. And then I start injecting. Again, some tugging.
Bon, we have a question. Could you please repeat how much do you inject per each injection point of Redensity-1 versus RHA-1?
There is no, when it comes to per injection of Redensity-1 per papule, there is no standard amount. What you do is you split your one syringe, which is 1 cc, into this half a face and then 1 cc on the other side. And you gauge based on clinical judgment of the per papule according to the age, the quality of the skin, number of sessions, as well as what you're hoping to and how quick. So there is no fixed amount, but roughly probably 0.01 per papule. But as I said, when you're injecting along the smoker's lines, and if Redensity-1 is the only product your patient will allow you to use, you will use a high dose. So that can be 0.02 per papule.
Well, talking about the papules, how long the papules will remain visible and how to ensure this is not a long-term side effect?
Yes. Now, the thing to keep in mind is Redensity-1 is non-cross-linked. So it is not going to give you long-term papules. The papules generally last no longer than 3 to 6 hours. So you can inject Redensity-1 with almost 100% confidence that it is not going to give you sustained papules because it's non-cross-linked. So as you can see, there's a little bit of tugging because you want to inject as close to the dermis as possible.
One question about a very special question about lower eyelid. Do you recommend to inject Redensity-1 to this area, and how much to inject to avoid edema?
Teoxane's official position, to answer your question, Teoxane's official position is that you don't inject Redensity 1 in the lower eyelid. So, but I understand that a lot of doctors want to inject Redensity 1 in the lower eyelid. Now, if you want to do that, you want to make sure you get the right depth, because if you inject the right quantity into the mid-dermis, you are unlikely going to have edema, but it has to be very little and very precise. So let me demonstrate that.
Thank you so much.
So you use a 33 gauge again, because that will give you the precision. You stretch the skin, and then you have to go in very superficially, and a very small aliquot. And you must see the papule. Don't inject too many. I would say maximum 3 to 4, and then that's all. Okay, now we are coming to, now I would like you to forget about everything I've done, because I'm going to demonstrate how I inject Redensity at RHA1 for skin redensification. Remember, RHA1 is cross-linked, so you want to make sure that you get the right depth. Actually, what I'm going to do is I'm going to demonstrate it on the other side.